We're going to use the skeletal model and we're going to take that subtalar joint assessment one step further. I'm going to actually start talking about the subtalar joint as a reference position. It's something that we call subtalar joint neutral, which is definitely part of sort of podiatry folklore. Subtalar joint neutral is important to look at reference positions. So when we're looking at ankle joint range or metatarsal joint range or rear foot range, we have a reference starting position. It's also important, certainly from an orthotic manufacturing perspective, to almost have a landmark of where that heel sits at a certain time and frame. When we look at the subtalar joint itself, and we're looking at the top end of it, so the talus itself, we talk about talar head congruency, and that's where we're looking at the medial and lateral head of the talus, and we're working out whether it's sat in more of a medial or a pronated position, or more of a lateral or a supinated position. But essentially we're trying to palpate with finger and thumb into that talus complex. So we look at the subtalar joint complex. It's important to remember that the subtalar joint is a rear foot structure. It's a combination of the calcaneum and the talus, and we're looking at frontal plane movement. So we're looking at the degree of eversion to inversion that's available within the subtalar joint complex. We often talk about a 2-to-1 relationship in terms of ratio shift. So that's 2 parts inversion to 1 part eversion. It's also important to see the effect that that subtalar joint movement has rotationally on the rest of the foot, and we still have quite a mobile foot through the forefoot. So the mechanical effect of those positional changes in that rear foot complex. So we look at the subtalar joint complex from behind, which is probably a more appropriate way to assess. You get a bit more field of vision around that subtalar joint complex. Bear in mind it's the calcaneus and the talus that we're interested in. So we're grasping either side of those structures, stabilizing, and we're looking to look at the degree of inversion to eversion. We're looking at the range of movement, and we're getting a feel for the quality of movement. Often with subtalar joint pathology we'll find restriction in range into inversion or eversion, and also we'll start to see swelling across that subtalar joint line, depending on the degree of pathology that we have around that area. Final way to look at subtalar joint range of movement, again we can look at it more from this end, is to grasp calcaneus and talus, and again looking for the degree of inversion into eversion, and we're looking at the range, and we'll look at the quality of movement across the joint itself. Bear in mind we're looking at predominantly frontal plane movement here. The subtalar joint itself is a joint that will allow triplanar movement to occur as well, so we can put a little bit of rotation into the assessment just to get a feel for that facet of movement. So we're looking at subtalar joint range. We're looking at how easy it is to glide this rear foot complex across from inversion into eversion. There's minimal force that I need to apply to this structure to get movement, whereas if we can compare that to the stiffer joints that we've looked at, we've really had to grasp and hold and shift that. There's a marked difference. And it's important to look at that individual variability that you'll have from patient to patient, because it will influence your orthotic design features.